Good afternoon. Each of us that have been diagnosed with acromegaly have unique journeys, and I would like to thank the organizers of the conference for giving me the opportunity to share my journey with you. On December 22nd, 2013, I was taken to Cambridge Memorial Hospital after having a vasovagal episode at home. A vasovagal episode happens when there's a sudden drop in your blood pressure. I had gone to use the bathroom and seemed to be taking a long time, so my husband came to check on me and found me unconscious on the bathroom floor. This was not my first episode. In fact, I had had them infrequently for years. I was monitored for several hours in emergency and deemed stable enough to go home. However, before leaving the hospital, I had another episode, and at that time the decision was made that I should have a CT scan of my head. The emergency doctor told me that there was no evidence of a stroke and that the radiologist thought that I should have an MRI because he was querying some finding. But he, the emergency doctor, didn't think I had anything to worry about. I'm so glad I didn't have this type, but I'm so glad all the doctors went through MRIs, because what I'm about to say was a lot of technical medical terms. I know you all know what it is. So the image on the left is a scout image from the CT scan that I had the night I was in the hospital. And the report noted that the bony sella is mildly expanded and a sella mass cannot be excluded. I had an MRI on March 3rd, 2014, and I encountered a doctor I had met on previous occasions. He afforded me the professional courtesy, and after the test was completed, he called me into his office and showed me the image. And as gently as he could, he explained that I had a pituitary adenoma. He reassured me that it was not malignant. Needless to say, I was in complete shock. The MRI on the right shows that the skull is thickened and widened and the muscles are hypertrophied. I guess this might have qualified me for Face Olympics if such a category existed. I received a phone call to return for further MRI imaging of the brain pre- and post-contrast, which was completed on March 10th. I do not have a copy of that MRI, but the report noted a pituitary mass measuring approximately 1.7 by 1.3 centimeters in the axial planes and approximately 1 centimeter in the anterior-posterior dimension. There is an extension into the left cavernous sinus, which measures 9 millimeters in cranial caudal and approximately 6 millimeters in thickness. There's likely extension into the right cavernous sinus. There was no mass effect on the optic chiasm, and the Meckel's cave on the right is asymmetrically enlarged. However, no enhancing lesion or mass identified. Armed with the information that I had a pituitary adenoma, I began my own research. As I was reading about acromegaly, I realized that I checked off a lot of boxes. Increase in ring size. As you can see, the difference in my rings. And I only resized a couple, so my daughter and granddaughter will be the recipients of all the other rings that no longer fit me. I had increase in shoe size from 9 to 11, facial changes, hypertension, skin tags, excessive sweating, sleep apnea. I don't think I had severe snoring, but my husband tells me otherwise. That's debatable. I slept through it. Carpal tunnel, obesity. I had significant weight gain despite playing badminton 3 times a week and exercising at least 5 times a week. I gained about 25 pounds. Osteoarthritis with painful knees, and the change in my voice has impacted my ability to sing. I like to sing. I met with my family doctor after he received the results of the MRI. It was a difficult conversation for him, but I explained that I already knew that I had a tumor of my pituitary, and based on the research I had done, I thought I had acromegaly. He referred me to an endocrinologist that worked in the clinic. Having met with the endocrinologist, Dr. Tushke, she ordered blood work. On April 10th, 2014, my IGF-1 was 721, and my growth hormone was 12.4. I was then referred to Dr. Reddy, a neurosurgeon in Hamilton. My appointment was on May 9th. He discussed my condition and reviewed my options, either to maintain the status quo, surgery, radiotherapy, and medical treatments. He explained what the surgical treatment would entail, also possible complications. He also advised that I may still need medication or radiotherapy post-surgery. I decided that I would have the surgery, so he arranged an appointment with the ear, nose, and throat specialist, Dr. Somnar, and they coordinated their calendars to accommodate my surgery. On July 14th, I was admitted to Hamilton General Hospital for my surgery. I have to admit, I was apprehensive. However, it was far too late to retreat. I woke up after my surgery with a bulky gauze dressing around my nose and a whopper of a headache, which was not surprising given what I had gone through. I think there was drilling, and more drilling, and removal of tissue. My IGF-1 dropped to 447 day 2 post-op. I also had diabetes insipidus as a result of my surgery. I was taught how to do the nasal rinses and discharged home on July 19th, with orders for a MRI 6 weeks post-op, an appointment at the ear, nose, and throat clinic to remove stents, and a follow-up appointment with Dr. Reddy in 8 weeks. I already had an appointment booked with my endocrinologist on July 25th. The pathology report indicated eosinophilic adenoma cell population with strong growth hormone immunopositivity, most consistent with this being a densely granulated somatotrophic pituitary adenoma. On July 24th, the stents were removed from my nose, and I was completely surprised and amazed how large the stents were. I could not imagine it coming through my nostrils. It appeared that my body had adapted to these external objects which were there for 10 days, and I was not aware of their presence or size. I was advised to monitor that there was no cerebrospinal fluid leak over the next few days. However, I had several spontaneous nosebleeds requiring packing of my nose, and eventually had to have cauterization to control the nosebleeds. On July 25th, I had an appointment with my endocrinologist, Dr. Tushke. She ordered an MRI at the CMH. I was also advised that there is increased risk of malignancy with regards to my multinodular goiter. Although this had been previously monitored, it now required closer monitoring. I was booked to see my family doctor to monitor my blood pressure, a follow-up with Dr. Tushke mid-October, and a requisition for blood work 12 weeks post-op was also ordered. The MRI report of August 18th showed post-surgery there was no obvious residual recurrent component detected. Signal heterogeneity in the residual left-sided portion of the adenohypophysis may be related to post-op change. However, continual imaging and clinical follow-up was recommended. Three months post-op, I saw Dr. Tushke. She advised that there was inadequate control of my IGF-1 and growth hormone. Her recommendation was to start sandostatin LAR 20 milligram injections once a month, for which she reviewed the potential side effects. Given the cost of the medication, and I did not have any drug benefits, she applied for me to be on the Access program. She also requested an immediate follow-up MRI and blood work to reassess hormone levels in 12 weeks. My MRIs over the next couple of years were uneventful, showing no significant changes. However, my IGF-1 and growth hormone were increasing, so on April 2016, the dosage of sandostatin LAR was doubled to 40 milligrams per month, which is the maximum dosage allowed. Instead of having one painful hip each month, both hips were painful immediately after the injections each month. Despite the increased dosage of sandostatin LAR, my IGF-1 levels continued to increase. I was also complaining of increased joint pain and skin tags. And on May 23rd, 2017, I had my first visit with Dr. Preptani. And the reason was because he had a lot more experience with acromegaly patients than the current endocrinologist that I was seeing. I was put on cabergoline, 0.25 milligrams twice weekly, and he recommended that my family doctor add medication for my elevated cholesterol. He also ordered blood work to test my IGF-1 levels in 3 months before seeing Dr. Tushke, and a follow-up visit with him in 6 months. Throughout the next 15 months, despite increasing the frequency of cabergoline from 2 to 5 to 7 days a week, my response to taking high doses of both cabergoline and sandostatin LAR was medically acceptable, but there was evidence of residual tumor on the MRI on August 2018. And once again, I was referred to Dr. Reddy, the neurosurgeon, for discussion on the possibility of a resection removal of the residual pituitary tissue. I saw Drs. Reddy, Somner, and Luthra for consult on September 27, 2018 at Hamilton General Hospital. Dr. Reddy offered me a surgical date in December for resecting the residual pituitary tissue. However, it was prior to Christmas, and I already had made my plans for winter vacations, traveling out of the country. So in deciding on winter vacation, surgery, winter vacation, you know which choice was made. I graciously declined the surgery in December. In April 2019, I saw Dr. Preptani, who reviewed the effect of cabergoline on my IGF-1 numbers, and there was not significant improvement. Therefore, it was decided to discontinue that medication. After my vacation, my redo or second surgery was scheduled, and on May 15th, 2019, I was admitted to Hamilton General for resection of the pituitary tissue in the sella and more laterally towards the left cavernous. I was discharged home the next day. Wow, how the length of stay changed in 4 years. Or did they feel that this was not my first rodeo, so I did not need to have a 4-day hospital stay? There were many follow-up appointments post-op. An MRI was booked for June 23rd. On June 24th, I saw Dr. Somner, the ear, nose, and throat surgeon, for the removal of stents. A follow-up appointment with Dr. Reddy on the 25th, and repeat IGF-1 blood tests were done in August and October, and then a follow-up with Dr. Preptani in October. I was pleasantly surprised when Dr. Somner removed the stents to see that they were much smaller compared to the first surgery. The MRI on June 23rd compared to the previous MRI showed that the sella was empty. Yay! In October 2019, at my visit with Dr. Preptani, he reported that my IGF-1 level was elevated. However, The decision was made not to treat with medication therapy at this time, and I would wait for repeat IGF-1 and growth hormone levels for further treatment options. This diagnosis has impacted my life in many ways. Medically, my last MRI was done on January 4th, 2020, and showed that the cellar was empty compared to the previous MRI. I've not had any further MRIs since. I've had blood work every 6 months, and my IGF-1 levels fluctuate between 231 and 284, which is above the normal range. Normal is 50 to 160. Much to my relief, I'm not on medications. I have noticed increased multiple joint pain, so I had a glucose tolerance test, and I think Dr. Preptani was talking about this, where they check your IGF-1 levels at the same time, and it requires drawing blood every 30 minutes for 4 hours. Not fun. However, the test revealed that my IGF level 1s are within my normal range. So I guess that my multiple joint pains means that I'm aging not so gracefully. My medical routine involves follow-up visits with Dr. Preptani twice a year for acromegaly monitoring, blood work every 6 months for pituitary function. I see Dr. Tushke once a year for monitoring multinodular goiter, which includes ultrasounds and biopsies of larger nodules. My family physician monitors my blood pressure and cholesterol and diabetes. All are currently within normal range. My blood pressure and cholesterol are controlled with medication, my diabetes with diet and exercise. I have an optometrist appointment once a year to check my peripheral visions. It's a good thing I'm retired to fit in all my appointments. I have observations post-surgery. Little did I know that having transsphenoidal surgery would have benefits years later. My mom resides in a retirement facility, and during the pandemic, their protocol was that visitors had to have regular COVID tests. As an essential caregiver, I had to have several PCR tests per week. And to the amazement of the nursing staff, I did not flinch as they performed the testing, which was just a breeze for me. I continue to have scabs shed from my nose once a month. Dr. Somner had told me that there was a possibility that this could happen. I like to swim. I'm unable to do the front crawl when I swim because water just pours into my nostril and I have no control of the flow, and it ends up in my throat, choking me. In reviewing the surgical note, the middle terminate was removed from my right nostril in the first surgery, and this is just me, I'm just wondering if that's part of the reason why I have no control. Maybe you can tell me, I don't know. But I do have a question for the doctors. I had a torus palatine removed many years ago. This is a growth on the roof of my mouth, a bony growth. It has now regrown with more tori on my lower gums. I wonder if this is a possibility that this could be associated with my acromegaly. I wonder if this is something that could be checked routinely. Would it be beneficial to conduct a study of patients with acromegaly to ascertain if tori are also indicators for early detection of acromegaly? I have stressors. Not because of you, Dr. Preptani, but every time I come to see you, I am stressed to get the results of my blood work. Is my IGF-1 increasing? Is he going to tell me I have to go back on medication? That would certainly impact my vacation lifestyle to have monthly injections again. Also, each time I have to go to my optometrist to have my peripheral vision tested, I wonder if I'm going to lose my driver's license. This would mean I would not be able to be independent to go where and when I want to go. Living out in the country, there is no public transportation, and walking is not an option to get to places. Advocacy. I wear my Ask Me About Acromegaly t-shirt to doctor's appointments. I have distributed Acromegaly Canada pamphlets to my family doctor's clinic, endocrinologist, dentist, optometrist, jeweler, and podiatrist. Since its inception, for the past 3 years, I've participated in Acromegaly Canada's virtual walk fundraiser. I post information pertaining to acromegaly awareness and Acromegaly Canada on my Facebook page. Had I had a choice to have acromegaly, I would have emphatically declined. However, this disease has afforded me an opportunity to meet some incredible people. I've recently stepped down from the board for personal reasons. The board of Acromegaly Canada has a determined and dedicated group whose mandate is to support and promote the awareness, advocacy, and education of this disease. I would like to thank them for their continued support, not only for the patients, but for their families and friends. I would strongly encourage anyone attending the conference to join the board as their positions open. Not done. I've poured through many albums and digital photos trying to identify when my facial changes were noticeable. I believe that around 2008 was when detectable changes in my nose size can be seen. Yeah, it's bad. I would like to thank my many doctors who provided me with the documentation that I could give relative facts. I would also like to thank my friend Pat Lee and my brother and sister-in-law who helped to produce this slideshow. Without their help, you would have had to listen to a boring monologue. In conclusion, I would like to recognize that our healthcare system may not be perfect, but I do feel fortunate that I didn't have to worry about paying for my many doctor's appointments, my surgeries, my many MRIs, and blood work. Thank you for listening to my story.